Well, you have made it to the second portion of the nursing process. The second step, formerly known as diagnosis, is now known as analysis. In my other video, I mentioned a acronym, ADPIE or ADPIE, but now it has evolved to more of AAPI because we're doing analysis instead of diagnosing. Kind of think of, I don't know if you guys ever watched Key and Peele, the Aaron. So this is ADPIE, but really now it's more AAPI because that diagnosis has changed to analysis. The reason it has changed to analysis is, and per the American Nurses Association or ANA, the registered nurses' analysis of assessment data or cues are used to determine actual or potential problems and issues during patient care. So it is more fitting because as nurses, we will be gathering data, and what we do with that data is we analyze it to ensure we are providing appropriate care. As you go through this module or PowerPoint presentation, ensure you are reviewing your key terms. I've provided a list here of your key terms. They are in your textbook. Just ensure you know the definitions. You'll hear us use a lot of these words. For example, Q we'll use interchangeably with data. That is your assessment data that you collect from your patient. So that objective, subjective data that you collect when you assess your patient. As you may have read in your textbook, the following slide shows you the purpose of analysis or problem identification. This problem identification can pertain not to only our patients, but it can pertain to groups or communities, and how they process or have potential problems and how they respond to them. We want to identify factors that contribute to or cause health problems. That's etiologies. That's the definition of etiologies. And then we want to identify resources or strengths that the person, group, or community can draw upon to prevent or resolve problems. So let's take a look at what diagnoses are. Nursing diagnoses are those that are patient problems that a nurse can treat independently, where a medical diagnosis describes problems in which a physician or primary care provider can direct treatment. Collaborative problems are typically managed by using physician-prescribed and nursing-prescribed interventions. You have to know the difference, and the big thing is when you're analyzing your data, the first thing you want to know is, with my nursing diagnosis or my priority problem, is there something I can do immediately as a nurse as opposed to getting an order from your doctor? Now, getting an order from your doctor might be a collaborative problem, which is still okay. I mean, it can still be a priority, but we want you to know that there are differences in nursing diagnosis, medical diagnosis, and then a collaborative problem. So let's take a look at this case study. You guys may have remembered it from your assessment PowerPoint presentation. Same patient, Jal Jones, male, 73, admitted with COPD. You have all this information here. What are some things that we can differentiate as a nursing diagnosis or a medical diagnosis? So let's kind of explore what we have here. We have COPD, we would classify as a medical diagnosis. So this chronic obstructive pulmonary disease would be a medical diagnosis because that would require a doctor, a physician, or primary care provider to intervene. Not necessarily a cure, but like they would have to provide treatment. Now, with this case study, we have a lot of signs and symptoms or subjective and objective data. So we're seeing all this data or cues. We can come up with a priority problem for this patient, something that we as a nurse or we as nurses can intervene and help the patient cope. So we know this patient is having trouble breathing based on his heart rate, his respiratory rate, and his oxygenation. We know that something we could probably do is see why this patient is fidgety. We can assess, and then we can come up with a problem of why he's fidgety. Now, we know this patient is having trouble breathing, so an intervention that we could provide is probably administer oxygen because of this. Do we know if this improves, will this improve and this improve? Probably, more than likely. So providing oxygen technically is a collaborative problem because we would need an order to provide that. It's not an independent nursing intervention. However, that is the most pressing thing at this moment. And that is called prioritizing. So we're going to prioritize helping our patient breathe better by increasing their oxygen, by providing oxygen. Therefore, once the patient is oxygenating better, their respiratory rate will drop, their heart rate is more than likely to drop. They might no longer feel that they're having trouble breathing. However, the very first intervention that you'd want to do if you found somebody having difficulty breathing is either help them sit up or reposition them and then place oxygen on them. Sometimes it can be just a positioning problem, and that oxygen exchange problem that's occurring can be fixed by sitting the patient up. So that oxygenation problem is your priority issue, and by repositioning the patient, you may be able to help them breathe better. You might even improve their oxygenation rate without providing oxygen. And if that happens, it could have been just a positioning problem, and that is where that nursing diagnosis occurs. So we don't need an order to reposition our patient. We don't need to ask the doctor to sit our patient up so that they breathe better. So hopefully that makes sense. In a medical diagnosis, you diagnose a disease, not you, but a doctor does, a primary care provider, and they take care of making sure that their interventions are specific to that disease. Whereas the nurse, using a nursing diagnosis, they are taking care of the patient in the response of their disease. So how they responded. So this patient has COPD and he's responding currently at this time per the disease that he can't breathe, his heart is racing, his vitals are a little off. And so as a nurse, we provide interventions first based on those independent nurse interventions. So in the analysis phase, what we're doing as nurses is interpreting the data or the cues that we gather from our assessment, from health histories, interviewing, looking at labs and things like that. What we need to do is interpret that data and then analyze that data. So there are 4 steps in doing that. So the first one is recognizing significant data. Then it's recognizing those patterns or clusters, identifying strengths and problems, and then reaching a conclusion. And the 4 possible conclusions would be there is no problem. So we've assessed our patient, they're healthy, there isn't anything wrong with them. Second would be a possible problem. We need more data, so we have to go back and maybe get more information. Third would be actual or potential nursing diagnosis or problem. And then the other one would be an actual problem or a problem other than a nursing diagnosis. So the first step is recognizing significant data. So when you are assessing your patient and you have gathered all the information you could, at that point, you are going to see what is significant and what is not. So an example, you are working in an emergency room and you get a patient that came in with a broken leg. The patient reports pain, 10 out of 10. The patient has a significant deformity on their leg. Their blood pressure is high, their pulse is high, their respiration is normal, their oxygenation is normal. They are alert and oriented. Other than the significant deformity on their leg, the rest of their assessment data is normal. So from all that information you have, you are going to recognize what is significant. So this patient has a broken leg, so that broken leg data is significant. That pain data is significant. Increased blood pressure, likely significant. The increased pulse, likely significant. All the rest of the data, because it's normal, is not significant. Now, moving on, so we got to recognize the patterns and clusters, what goes together. So knowing that this patient has a broken leg, we know that they're going to have pain. So that seeing that deformity on their leg, that is significant data. They are reporting pain, 10 out of 10. We see that they're in agonizing pain. That's your objective data. And then their pulse and blood pressure are elevated. Now, that pulse and blood pressure, as we think of perfusion, may or may not be significant and may not be pertaining to the broken leg itself. Maybe this person has a history of heart issues that they don't know about. However, looking at the current problem of the broken leg, we can say that elevated blood pressure could be caused by pain, and that elevated heart rate could be caused by pain. So now you are recognizing that pattern and you're clustering, you're putting it together kind of like in a bubble, setting it aside, and then identifying the strengths and problems. So at this point, you have all this data that you can say, I think I know what the problem is. Is it a possible problem? So the possible problem is the patient could potentially have pain. However, with this patient itself, we know that there's an actual problem. The problem itself is the patient has pain related to their broken leg, as evidenced by the report of pain. You can see that they're in agonizing pain and the deformity of their leg. And then at that point, you've reached your conclusion and you have interpreted that data, you've analyzed it. Now you want to make sure that it actually works. And so you validate it by going back and making sure that the assessment data makes sense. Once you have that problem, you can start making that diagnosis, that nursing diagnosis. And I definitely recommend in the book in page 434, looking at box 16-1, they have a really good checklist on how to identify potential problems versus actual problems. So the 3 types of nursing diagnoses we're gonna look over, I mean, there are only 3 types, are first, it's a problem-focused nursing diagnosis, which is a clinical judgment made by a nurse to identify and describe specific health issues or problems that a patient is currently experiencing. This type of nursing diagnosis is focused on addressing actual health problems and conditions that the patient is facing at the time of assessment. It serves as a critical component in the nursing process and guides selecting appropriate nursing interventions for your patient care. The second kind is a risk for nursing diagnosis. So it is a judgment made by the nurse to identify individuals or groups of patients who are at increased risk of developing a specific problem or complications. Unlike a problem-focused nursing diagnosis, this is very specific on trying to prevent it from occurring. So if we have risk for nursing diagnosis, we are doing things to hopefully prevent from it actually occurring. For example, I think you guys probably heard a lot of my things at ARCH were risk for diagnoses because you know, the individuals at ARCH are relatively healthy, although they might be at risk for certain things. Other things you've heard me say are risk for falls, risk for injuries, risk for infection. So we know those things are not occurring. They're not actual nursing diagnoses. They're not, they haven't developed yet, but the patient or group have shown certain signs and symptoms that would point to us for it to be a risk for nursing diagnoses. The last type of nursing diagnosis is a health promotion nursing diagnosis, and that is the clinical judgment made by a nurse to identify an individual's readiness to engage in activities and behaviors aimed at enhancing their overall health and well-being. So this is different from problem-focused nursing diagnoses because this actually focuses on health promotion, which is concerned with recognizing that we can motivate patients to change, to do things for their well-being. These diagnoses help nurses tailor interventions that support and encourage patients in their efforts to achieve and maintain optimal health. So some examples of problem-focused nursing diagnosis would be acute pain related to a surgical incision, or impaired gas exchange related to a patient having an asthma attack. Now, health promotion, that one would be something like readiness to enhance nutrition, readiness to enhance parenting for a new parent. Then the risk for diagnoses, and you heard me saying before, those are like your risk for falls, risk for infections. And then you use these types of nursing diagnoses to guide you to your interventions. Once you have gathered all your data, analyzed your data, figured out a plan, then is when you start to formulate your problem statement. So the problem statement is based on all that information and whether the data you gathered and analyzed leads you to a problem-based nursing diagnosis, health promotion nursing diagnosis, or a risk diagnosis. And if you look in the book chapter, page 440, there's kind of like a little blue box that tells you how to remember and to formulate your problem statement. So it's the acronyms PE or PES, which stands for problem, etiology if it's PE, and then PES is problem, etiology, and signs and symptoms. So you need all these things to write an appropriate problem statement. For example, I gave the problem statement for acute pain. So that would be your problem. So what you identified, what's happening. So the acute pain, and then the etiology for this one would be related to the surgical incision. And then the signs and symptoms is basically any of that data you collected. So that is patient reports pain, 10 out of 10. Patient has a surgical incision. So any of that assessment would be in that problem statement. The risk for type of problem statements or nursing diagnoses would only carry a problem and etiology because they technically are at risk for something and they don't have the signs and symptoms for an actual problem. So risk for diagnoses typically won't have signs and symptoms. They would have something like, say it's that patient that has a broken leg, but it's a compound fracture that sticks out of the skin. That patient is at risk for infection, but they don't have that infection yet. So they are at risk because they have an open wound from a bone breaking, but they don't have an infection yet. So they are at risk for infection because they have an open wound from their break, but they don't show the signs and symptoms of an infection. So we will, as nurses, do everything we can to prevent an infection from occurring. This slide here just kind of goes over some questions you can ask yourself when you're assessing your patients while you're at clinical or ARCH, during lab, sim, everything, to have that clinical reasoning and clinical judgment. These are the things that we want you to build upon because you will be able to eventually create your nursing diagnoses or come up with your nursing diagnoses based on the information you get and make that judgment on how to treat what's going on. And these are great questions to ask yourself. I'm not going to go through them. I'm just putting them on this PowerPoint so that you start looking at your patient care. So anytime you're in lab and you have maybe a small scenario, or you're in your simulations, or when you make it to clinical, ask yourself these questions so that you are facilitating clinical reasoning and clinical judgment during your diagnostic phase. Next are common errors when formulating and coming up with nursing diagnoses or like analyzing the information you have. So how do we prioritize these problems? We call them priority problems because they kind of have a level of how we should take care of them. And this is where you guys learn Maslow's hierarchy of need, and I think you guys learned it in your health promotion hybrid lesson. But knowing that physiological and safety are likely the most important, and then everything else is low priority. Someone who comes into the emergency room with difficulty breathing, and they're also reporting pain, their oxygen O2 sats are at 82%, their heart rate is elevated, we'll come up with some nursing diagnosing problems. So they're having trouble breathing and their heart rate is up. So we can say ineffective breathing or ineffective tissue perfusion, depending on what's happening. And then we'd say pain is another problem. But of the two problems, which one is the priority? Well, we want to ensure this patient's breathing oxygenation is taken care of before we take care of the pain. And so the priority in that scenario would be the physiological things. So taking care of the patient's breathing, oxygenation, which will then help their heart rate go down. And then once we've taken care of that, then we can help the patient with the pain problem. Because we need to prioritize what's important. We need to ensure that we know that safety is probably like the biggest prioritization. So sometimes there are certain scenarios where safety will trump something else. I think we can think of like somebody who's having blood pressure issues. They might be having issues with tissue perfusion, but if they're also threatening to hurt themselves, I think the priority would be take care of the patient so that they don't hurt themselves. So it's looking at your patient as a whole. Once you've analyzed your data, clustered your data, come up with a problem, or you're probably going to come up with several problems. Which one takes precedent? Which one needs to go first? That's how we prioritize. And so think of your airway, breathing, circulation type things will always kind of come first. Safety would be like the next thing. And then psychological things can be the last. It's not saying that they're not important, because psychological things are important. It's just we need to take care of the patient to ensure that they're going to live and survive whatever's going on. And then we can take care of the psychological stuff. And that's basically what we do at the end of coming up with these nursing diagnoses or priority problems. We have to figure out what is more important. We call that prioritization. So with that being said, you guys have made it to the end of this lecture. And we'll see you in class in a few.